My name is Matthew Manley, and today I'm going to present and talk about the model of communication. I chose my setting to be at a physical therapy rehabilitation center. I feel like this is a good example of why communication is important, clear communication. With We all know that with communication, there's five. When you're talking about a model of communication, there's five good details to communication. You've got your sender, your encoder, your message, your decoder, and your receiver. And for those five, you have your sender, which is your physical therapist or occupational therapist. You have the encoder is going to be the physical therapist's mouth. The message is going to be the instructions for um, the patient to do. With that said, the decoder is going to be the patient's ears, and the receiver will be the patient. So, with that said, you have also the noise. With the noise, the I would say the noise would be the rehabilitation center's background. So background noise. So you have the other therapists, uh, the other patients that could be asking questions, communicating as well. Um, so with communication with the physical therapy or with anyone, communication is key. It's to be clear and effective. The therapist wants their patient to get back to 100% healing. And so with communication, if you're clear and you specify exactly what you want, then that communication is gone through and cleared with the encoder, and the patient accepts that. And so with that being said, they're going to get a more effective therapy. And I see this. I work at an outpatient physical therapy. Actually, we do occupational and speech, but most of the time it's more physical therapy than anything. And I see how important communication is for a patient. And not only that, with a therapist, they send their plan of care to the doctor, and they type up, whether it's on paper or on the phone. They're talking and explaining what they need. What the doctor expects the therapist to perform, and what the therapist expect the patients to perform. And with this, with communication, you see a great percentage of increased, you know, the patient recovery. They go through and they go through their 12 weeks of rehabilitation, or however long the therapist feels like they do that, and they come and see the patient. The patient comes to see the therapist twice or three times a week, and they communicate what routines or exercises they want the patient to do. And I felt like with the therapy and patient relationship was a great model of communication for this project. Thank you.